Welcome this morning, and obviously to Ireland for anybody who's travelled. I think there's no better way than to start a Monday morning, but we're talking about mental health. It's always good to start a week off on a good note. I'm going to maybe tell you briefly a little bit about me specifically in the area of mental health and why I use the platform that I have to engage with communities in relation to mental health. So, like Ricky said, I'm from the west of Tallaght, and it would be one of the most deprived areas in the country in relation to socio-economic resources and income inequality and education inequality. So throughout my career, I found my engagement with mental health being very focused on those most marginalised and deprived groups and their access to services. And I suppose working in the addiction sector, obviously mental health, my first kind of real introduction to the area of mental health would have been in relation to dual diagnosis. And obviously the lack of services and access to help in Ireland for dual diagnosis. We still have a system in Ireland where, you get sent from pillar to post in relation to addiction and mental health. And there seems to be still, we've just actually launched a plan in relation to dual diagnosis, so I'm hoping that can change and that the mental health services and the addiction services can work together in relation to building joint care plans for anyone experiencing dual diagnosis. But then when I went on then to into Trinity College really, and then into the Shannon, I was attending really amazing mental health events. And I was learning so much, and I was learning something new all the time, and I felt really empowered by it. But every time I looked around the room, what stood out to me most was there wasn't people from the communities that I came from at these events. And I kind of felt that, that needed to change. And how can we bring sometimes the people that need the services the most actually are the least likely to be able to access them, and how can we actually change that culture and encourage young people from working class and low economic backgrounds into them spaces. So from there I decided last December to use the platform that I have to organise an event called Tallaght Talks, and that was kind of on the back of a cluster of suicides in the community where in the space of 3 weeks, 4 or 5 young people had taken their lives in a very small community. So we had this event, and the biggest thing that came out of that event was 2 things actually. One of them was that there was these services that they only became aware of in their communities after the fact. So after the crisis had happened, after the life was lost, and they were confused about how they didn't know about these services before. And I think what I took from that was that there is the likes of Jigsaw doing great work and other projects doing great work, but sometimes young people don't know that the services are there. And I remember many years back when we were setting up addiction programs in communities, the biggest thing that we did with young people was meeting them where they were at, and going out on the streets and doing outreach work into the communities, instead of just having a service opening the door and expecting young people who sometimes have a natural distrust of services historically, or authority figures or institutions. And so I kind of felt after that event it was really important for services, especially community services, to actually spend a year or two to getting to know their communities and coming out onto the streets and visiting the youth clubs and building that relationship, so that them young people feel that they can then enter into your space that you have opened up on behalf of them. The other one was mothers and families, sports coaches and teachers saying that they don't know how to respond. And sometimes we can very focus on the individual and how do we help them and empower them. But what families were saying is sometimes we are the first responders and there is no services, and it's like, how do we respond? And we really want to learn and be empowered about how we can respond to our young people and our sons and daughters' mental health, so that we aren't advising them wrong, that we're not dismissing what they're saying. So I just think, and I mean, it's not going to be up to youth mental health services to do that, but it's another part in terms of working with adults and families about how they respond. I think I'll finish on, I suppose, where I've moved on from that was about how we engage young people in the services. And Jigsaw Tala and Jigsaw Clondalkin, and maybe some youth people in Ballyfermot, some of the most working class areas, have decided to come on board with me to have a big event in February. With the most marginalised young people and from different minority backgrounds, from the travelling community, from the migrant community and all different communities, for them young people to have a big round table conference where they will build a national youth manifesto which will very much focus on kids coming from impoverished backgrounds and how they can actually access and be part of the system. So I suppose why I focus on that is that there's so many people here that are involved with services and that want to do good work and will open up in working class communities. So I suppose that my advice and something to think about, which I'm sure you are all doing, is that although we're looking at national mental health programmes, we need to find out and work hard how we get those national mental health programmes into some of the smallest corners of some of the most marginalised communities, and how can we really tie them in together. And I think outreach is a huge part of that, and that's just coming from my background in the addiction sector. So I'm delighted to be here today and maybe just share a little bit about my involvement and why I care so passionately about it. And I wish I could spend the 2 days here, but unfortunately I can't. I'm on the education committee tomorrow, and we just launched also a positive mental health in schools plan. So I'm back in there tomorrow, which I have to go home and prepare for today at some stage. So I'd hopefully stay for the morning and might meet a few of you and learn a few new things from the speakers of the morning. And I hope you have a great time here in Ireland and also in the conference. And best of luck with all the work that you are doing. And thank you for the work that you are doing. Thank you.